Thousands of people across the country have gotten through the coronavirus, and obviously their experiences with the disease range from relatively mild to all the way to being intubated and put on a ventilator and near death. But a lot of people, even at that so-called mild end of things, are talking about just how nasty and relentless an illness it can be. A nurse in Tennessee recorded this first-person account of her symptoms.
Excuse me, it hurts to breathe. I just want to tell you, don't take this as a joke. This is not a joke. You can't see your family. You can barely talk. You're trying to do everything you can to stay sane. This virus is attacking whomever. Doesn't matter your color or your age, your health condition. This is no joke. Stay at home. If you don't have to go out, stay at home. This is something you don't want. I never felt a gunshot. This is probably worse than a gunshot.
That's just one of the stories of a frontline worker surviving coronavirus. Joining me now is Dr. Derek Cass, Associate Professor of Emergency Medicine at Columbia University Medical Center. Dr. Cass joined us 3 weeks ago while quarantined after contracting the virus while treating patients in the ER. Dr. Cass, welcome back. How are you feeling?
I'm feeling, from the coronavirus part, I'm feeling pretty good. I'm a little sad to watch that video and to see more and more people on my Facebook feed announce that their parents have passed. So it's pretty terrible. But for me personally, I feel pretty lucky and pretty good right now.
How was, can you describe what your sort of experience of the virus was, your symptom profile, how long it lasted, things like that?
So I was symptomatic for about 8 days, which is pretty typical for the mild course of illness, where I had the muscle aches, the fatigue, the headaches, this very persistent cough, shortness of breath when I walked from one room to the other. But I never really developed the high fevers or the lack of oxygen that meant that I was worried that I needed to go to the ER. A lot of my friends, actually, other healthcare workers and other people that are just regular folk, have contracted the virus and had to go to the hospital, been put on oxygen, and even been intubated.
Yeah, I now know a number of people that have gotten it. One thing that several people have said is sort of different waves of cycles, that it was actually like 8 days was sort of in the middle or even shorter range. But people I've talked to have said 14 days. And, you know, after 9 or 10 days, they think they maybe feel better for a day, and then they have a second wave of symptoms.
So actually, that's one of the things that we talk about amongst ourselves, like healthcare workers that get sick, because we find out we have it day 4 or 5 or 6, and we don't even consider it a case closed until day 8, day 9, day 10. And that a lot of people who get very sick don't even go to the hospital until day 8 or day 9. And they wind up having a 14 or an 18-day course of illness. And especially if you get intubated, you could be on the ventilator for between 1 to 3 weeks.
So as someone who had the virus, was self-quarantining by yourself, and also is an emergency room doctor, how are you monitoring yourself? What were the triggers you were looking for? Because right now, you know, the advice to people that get it is to stay at home, don't stress the hospital system more than you have to. But obviously, like, if you need to go to hospital, go to hospital. But that's a tough call to make. How are you monitoring that?
So I think first and foremost, that's a great use of telemedicine, right? So if you're ever scared about whether or not you should go to the hospital, just do a telemedicine visit. That's first and foremost. I think that when you're monitoring yourself at home, if you're fortunate enough to have a pulse ox, so a thing that you put on your finger to check your oxygen, that's actually a pretty good data set to make sure that you're okay or you're not okay. And a lot of hospitals now are actually sending people home with pulse oxes to monitor them at home to keep them out of the hospital. But the other things to worry about, and we worry about it too, are, can you breathe? Literally, can you take a deep breath without hesitation? If you watch that nurse in the video, she could not complete sentences without taking an extra breath.
Right.
She had to stop. That was a telltale sign that she probably shouldn't stay home, at least before being evaluated by a doctor. So the fact that she was in a hospital being evaluated was important, because if I had seen her at home on telemedicine, I would have told her to go in. Our hospitals are open for the sick patients. They just need to keep the well patients out for now.
Are you back at work now?
Yep, even tonight. After this, I'm gonna go to work. I am back at work.
So, and what has the experience been like? And do you know, like, do you have now antibodies, and so you're now in a sort of different situation than I would imagine a lot of your fellow workers who are very worried, obviously for very legitimate reasons, about contracting it?
So actually, all the segments you had before this are really important for this idea of getting back to normal and actually reintegrating into society, because I'm in this very gray zone of both having antibodies and not knowing if I'm still contagious, which is why I'm living in a hotel.
Right.
So after you have the virus, there's a period of time when you're still contagious but not symptomatic. And we don't actually know how long that is. In a lot of cities and a lot of states that have a lower prevalence of disease, they're testing people to prove they're negative before they go back to work. That's not happening in New York because we just can't do it. So until I know that I'm negative, I'm not going to reintegrate into my family because I have an immune suppressed son. So now we know, so I'm going back to work wearing a mask as I've been instructed by the CDC and all standards of care, and being symptom free for almost 3 weeks.
So final question for you, because Paul Romer was talking about this earlier in the show. In terms of just healthcare workers, the folks that work in the hospital with you, doctors, nurses, and then also janitorial staff and other support staff, is there enough testing that all those folks can get tested if they need to, or is it still being rationed enough that they can't?
It's not enough. There's not even close to enough. I couldn't tell healthcare workers who are at home seeing me on telemedicine, how to easily get a test in New York City if they needed it. It's very variable based on the region you're in, the hospital you work for, whether or not you have testing facilities that were federally supported but now aren't federally supported. Maybe they're federally supported. There just definitively is not enough testing. And we know that, which is why we need the federal government to take leadership in this aspect. Because without them, we're never going to be ahead of the testing and surveillance we need, especially in a city as dense as New York City.
All right, Dr. Derek Cass, it is great to see you feeling better and on the recovery end of this. And thank you both for coming on and for all your work. Really appreciate it.
Thank you so much.